Hi, we're back again consulting with a professional. I'm Jesse Newman, and I have the pleasure of having as our guest today Dr. Fred Barr, a board-certified plastic and reconstructive surgeon here in the Palm Beach area. And I think we're getting ready to discuss surgical procedures for cosmetic surgery for men. Now, Dr. Barr, I mentioned the fact that we've got this two pictures of Cary Grant. It's obvious that their pictures indicate that it's probably, what would you say, 40 years between these two pictures? 30
I would say
years?
so. I think what we can do now perhaps is look at these two pictures and point out what some of the changes are that we see. And we'll start first with the forehead. The forehead in the aging process shows the wrinkles. There is a droop of the whole face. And this basically is due to several different phenomena. One is gravity. One is, again, the genetic predisposition of the skin. Another one is that with age there is a thinning of the skin, an actual thinning process and an actual loss of the fatty tissues that support the overlying skin. And in time there also is a diminution in the actual bony structure.
Now, when you say the fatty tissues, now it's sort of understood that when a man grows a little older, he gains a little bit more weight.
Right.
Because he's not actively exercising as much as he did when he was young.
Right.
So in one instance he's gaining weight, and yet you're telling me the fatty tissues go.
Yes, I am, because it is not necessarily a gain in weight in all areas. The weight distribution is the primary factor for weight gain. So there not necessarily is that fat is accumulated in all areas and evenly distributed. It's a different areas where this may be accumulated.
Okay.
And again, this refers to gravity. So let's start again. The forehead, you see wrinkling. Okay? The first areas where aging begins is around the eyes. You see the sag of the lower eyelids, the sag of the upper eyelids, the brow begins to droop. There is perhaps fatty protuberance in the compartments under the eyes and above the eyes, and generally in time there is also what appears to be a smaller volume of the eye itself. And this is an optical illusion because of the excess skin and fat tissues that are really covering the eyes. From the eyes themselves, then we move to different areas around the chin and the jawline. With gravity, with age, the next process we see are beginning to be undulations of the jawline. Rather than the clear-cut, sharp, defined jawline, we see sagging to occur from here to some of this that's being done. Then we begin to see in the neck the wrinkling process, the excess skin. It's hard to tell here, but there are what we call the platysma, which is the muscle of facial expression, which comes from here and inserts all the way up to here. This begins to sag and begins to perhaps separate in the midline, producing the banding phenomenon that we see in the necks. Around these areas, from the nose to the angle of the mouth, there is a very large accumulation in what we call the nasolabial fold. So from a smooth contour here, we now have the overhang and the droop. Again, in the forehead, we see the wrinkling. We see between the eyes what's known as the glabellar area, the wrinkling and the fact of gravity pulling down on the tissues, the diminution of the fatty substances underneath and the thinning, and eventually we even get a droop of the nasal tip. All in all, the picture combined shows that what was up here at one time is slowly drifting down this fashion.
All in all, there's probably 100 million women in America that wouldn't want to change Cary Grant.
Absolutely.
One little iota.
Absolutely, and that's a very important point because surgery is not for everyone. Nor do we want to change a Cary Grant into somebody else, or could we possibly change somebody into a Cary Grant. What we can do is pick the points that are on your mind that concern you and deal with them in a fashion that either we can provide improvement or we can't. And we as physicians need to be honest with you to tell you what we can and cannot do.
Well, in my mind, I'd be very happy if you made me look like that.
You're much better looking, Jesse.
Oh. Anyway, surgical procedures. Dr. Barr, tell me, we're talking about the eyes, the nose, the chin area. My mind goes to, can this be outpatient? Do you have to go to a hospital? can they all be done at once? Do you do an eye first and then 6 months later, how long in the healing process? I'm confused and I'd like to be enlightened. Perhaps
Okay.
our
I think perhaps the first thing that we should do is look and see what exactly these procedures are. And I have a chart here that has been compiled by the Board of Plastic and Reconstructive Surgery, the Society. And this is essentially the statistics showing what the procedures are and what has been done in 1984, percentage of the total being performed on men. And if we go through this, we see the first category is the tummy, abdominoplasty. And we see that 5% out of the total. Blepharoplasty is eyelid surgery. Surgical body contouring, you've heard of this as far as what we can do with the fat, and again it's broken down into these areas here with the suction lipectomy. Hair transplants, nasal correction, what's known as iridectomy or facelift procedures, a chin operation to either reduce or improve the contour of the chin, otoplasty or corrections of ears, and then last is a chemical peel, which is either the sanding or the chemical application to remove the fine wrinkling. With these procedures, we have seen, again, the increase in this as far as the male population is concerned.
Let's go over that common usage. Which one is the eyes?
This is the eyes. Again, we said that...
So there's 10,000 have been done for men and 74,000 perhaps women. That gives you a pretty good idea that women are more concerned, but although men may be shy and bashful. Is that correct?
I think that we're talking and seeing now a influence that the public has, that the media has, that the male themselves have on wanting and desiring to look and feel better. I mean, let's take a look here. Just again, sitting on the table, the New York Times magazine, Men's Fashions of the Times. This is 1986, September. Okay, so no longer really is it a marketplace strictly for the ladies. This is something that we are all aware of, and I think that all of us want to look and feel as good as we can. And again, it is not for everyone, and I'm not here to say that all men or all women should have surgery. But what I am saying is for those individuals that want to explore this, the options are available.
When you do the surgery, let's say the eyes, there's some sort of anesthesia involved.
Yes.
Is it local?
It's a combination. What we do is, my particular choice is to have the patient in the hospital, an intravenous line set up where medicines can be administered by the vein, which are either Valium or Pentothal, things that make the patient sleepy and in a state of twilight sleep.
Now how much after the surgery, let's say, are the stitches ready to be removed? And when you do remove the stitches, A, there's no anesthesia then, I imagine, and B, does it hurt to take the stitches out?
Okay. Some people will experience a pulling effect from taking the stitches out, but usually, for the most part, the stitches are not a big part of the procedure and not a big part of pain being produced. When we do the surgery, we're cutting the superficial nerves, and these are areas that are along the scar line will be anesthetic. And this is a blessing in disguise that those areas that we've already operated on may not have the sensory feeling to them, the perception, so that suture removal is not a big problem.
So there really isn't an area of complications involved?
There is an area of complications. We try to minimize this by doing everything we know how to first present what we feel is an honest appraisal, to do the safest procedures that we have in the areas that are the safest, and to choose those patients that we feel will get the best results and have realistic expectations.
I see that the lipectomy, is that the tummy tuck or taking in
Taking out fat.
That's the biggest proportion of difference between men and women. Now, I'm not sure what would be worse, your fee to do it or a new wardrobe.
I think if you're looking for quality, you're going to pay for quality no matter what it is. That's what we're talking about.
Well, you know, Dr. Fred Barr, it's, we really couldn't get into this any deeper in the short time allocated to us, but what we've done today, hopefully, is to alert you professionals and you men who are viewing us today. And thank you, Dr. Fred Barr. It's been great having you with us.
Thank you, Jesse. I appreciate being here.
My pleasure.